How are you doing today, Mr. Boyle?
I'm fine.
Good. Good to see you.
Nice to see you too.
Good. I wanted to talk to you a little bit about your high blood pressure. I know that it's been something that's been an issue. It seems like generally it's been reasonably well controlled. Is that correct?
That's correct.
Okay. And are you taking your medications?
I'm taking all the medications.
Okay. And have you experienced any problems with any of them?
I have experienced a few problems.
Okay.
Maybe we could deal with them one at a time.
Okay.
The blood pressure problems. I seem to be having problems as in the mornings when I get up, I'm feeling a little bit lightheaded. As the day goes on, I'm feeling a little bit better. And then by the nighttime, I'm very fatigued.
Mm-hmm.
And I don't know if that's a blood pressure issue or maybe some combination of the other drugs that I'm taking.
Okay. Have you checked your blood pressure at any of those points in time?
I did some months ago, but I have not done that recently.
Okay. And you said that you're dizzy. Is that when you stand up quickly?
Yes, that's correct.
Okay. Have you had? I know you've also had some sinus issues, some difficulty with muffled sounds and congestion. It's possible that that might be playing a part in it too. Have you had any ringing in your ears?
I have not had any of that.
Okay. What about sinus tenderness?
No, still just the feeling of clogged ears.
Okay. Do they pop occasionally?
Most recently they have been popping,
Mm-hmm.
but that's new.
Okay.
And that's the more favorable feeling, actually.
Mm-hmm. And are you having any nasal drainage?
I have not had it.
Okay. And what about cough?
I've just had a throat that seems to be full, like I need to cough, but I'm not coughing.
Mm-hmm.
A fullness sensation in the glands.
Okay. Do you get the sense that something's running down the back of your throat?
No, not really.
No? Okay. What about any headaches?
I have been having some headaches.
Okay. And are those mainly in the morning?
Usually towards the end of the day. More than anything.
Okay. How would you describe your sleep?
Erratic at best.
Mm-hmm. And that's been sort of a pattern, hasn't it?
Yes.
Okay. What time do you go to bed?
Ranges from 9-ish to in the 10s.
Mm-hmm. And do you fall asleep immediately? Or?
Yes.
Okay. And then what happens?
Usually awake around 2 o'clock or 3 o'clock
Mm-hmm.
for some period of time, and then usually can get back to sleep till about 4:30, 5.
Cannot get back to sleep?
Can get back to sleep.
Okay. Oh, I see. So how long are you awake at the 2 o'clock?
Anywhere from 30 minutes to an hour.
Okay. Do you find when you wake up, are you having any symptoms like reflux or any burning in your chest that might wake you up?
There has been at times reflux, but not in general, no.
Okay. Is your mind racing, thinking about things at work? Or?
Of course, it's always racing.
Okay. And do you find that, is that intensified recently?
No, not necessarily.
No? Okay.
Actually, it's gotten a little better
Okay.
recently.
And what about caffeine use?
Probably a tremendous amount first thing in the morning,
Mm-hmm.
and then none after lunchtime.
Okay. And when is your last meal of the day? What time?
Between 5:30 and 6:30.
So it's pretty early. Okay. Alcohol consumption?
Moderate.
Okay. Is that pretty much stable, what you do?
Mm-hmm. Yeah.
Okay. And how about exercise? How are you doing with that?
Terrible.
Okay. And
Trying, but I got the treadmill fixed,
Mm-hmm.
so I'm going to be back on that and all other machines that work.
Okay, good. One suggestion might be to buy a notebook and actually create a log before you exercise. And I think if you created your weight log in there as well, and maybe a blood pressure 2 or 3 times a week, it would be an incentive to you when you start seeing your weight go down and when you see your blood pressure be a little bit better controlled to keep up exercise. So that might be one suggestion. I think what we'll do today, since a lot of your symptoms really focus on the ear, eyes, nose, and throat, is we'll examine that part today, if that's okay. You'll have a seat up here, please. I'm just going to wash my hands. Are Are you still using the inhalers or the nasal spray?
I have not.
Not recently?
Used them up.
Used them up, okay. Did they help you?
I think they did.
Okay.
I think that's why the ears are crackling again.
Okay.
So that's good news.
Okay. Will you take the glasses off, please?
Yeah.
Okay. Tell me if this is tender at all. Is that tender?
No.
How about here?
No?
No? Okay. Follow my finger with your eyes. Okay, good. Close your eyes for me. Can you hear me?
Mm-hmm.
How about over here? Okay, good. You can put your glasses back on. I'm going to take a look in your ears. Actually look a little better than they have in the past. There's not any redness. As I told you before, there seems to be a little bit of fluid in there. That's a little bit less this time than the last time. Does one ear bother you more than the other? No. Okay. And I'm going to look in your nose. Just put your head back just a little bit for me. Okay, good. In your mouth, please. Second one. Okay. And will you stick your tongue up to the roof of your nose? Down this way, okay. Good. There's a little bit of what we call cobblestoning in the back, which is kind of a, if you think about what a cobblestone sidewalk looks like, kind of splotchy red versus white, which probably is some postnasal drip. Okay. And I'm just going to feel your left nose here. Okay. Any positional component to your dizziness, turning your head quickly, or no. You did say that you had it when you sit up. Okay. Okay. Well, I think that we're going to look at your heart and lungs a little bit later in the exam, but I just wanted to kind of focus on the head and neck complaint right now. Okay. And I do think that since in the past you responded to the nasal steroids, we'll go with those again. There's no sign that you need antibiotics right now.
Excellent.